at World Mental Health Day. Now, every 10th of October is being celebrated as World Mental Health Day, and this is to raise awareness of mental health issues and also encourage efforts to support those experiencing mental health issues. It was first observed in 1992 as the initiative of the World Federation of Mental Health. This year's theme, Access to Services, Mental Health in Catastrophes and Emergencies, highlights the urgent need to ensure mental health and psychological support reaches people affected by conflict, disaster, and displacement. In 2025, this call is more pressing than ever as humanitarian needs continue to rise worldwide. It also reminds us of the importance of mental health at work. Safety, health, working environment can also act as a protective factor for mental health. Unhealthy conditions, including stigma, discrimination, and exposure to risks like harassment, can affect mental health, as well as the impact on their family and their poor performances. Now, 12 billion work days each year cost the global economy around 1 trillion naira annually. Now, this and more are some of the issues we'll be discussing with our guest. But let me first welcome Honorable Ahmed Sajo. He's the former Commissioner of Adamawa State. He's also a very good friend of the House, a journalist, an analyst. Everything you can talk about, Ahmed Sajo. Ahmed Sajo, many thanks for joining us, sir.
Thank you very much. When you said a very good friend, I was started the set of the House.
All right. And Dr. Nabila Man-Isa, who is the a psychiatric resident doctor with the Federal Medical Center, Jabi. Many thanks for joining us.
You're welcome. Happy to be here.
All right. Do we say happy World Mental Health Day in Arias?
Yes. We celebrated a few days ago, but I believe that the spirit of the Mental Health Day
so you're mentally stabilized now?
I would like to hope so.
All right. So before we go into the details, for some people who will be looking at or watching us now, I'm like, this crazy set of people today on the show, mental health. Maybe you begin to tell us what exactly is mental health. Is it that it's an illness on its own, or some kind of, words put together?
All right, that's a good question, because you see, a lot of people, when they hear mental health, they always think of, someone being mad, insane. That's where people's thought goes to. But the truth is, mental health is much broader than that. It's much more broader than that, because mental health actually encompasses a person's psychological, emotional, and social well-being. So you can imagine how much of an impact your mental health will have in your life as a whole. And even the World Health Organization actually defines health. When you look at the definition of health as a whole, it defines it as a state of being healthy physically, socially, mentally. So it tells you that it takes 1/3 of your general health. So if your mental health is not at its best, then you can imagine how much of an effect it's going to have on your overall, health in general. And because, like I defined it earlier, it has to do with your psychological, your emotional, and your social well-being. It means that it definitely affects how you think.
Which one affects more? Is it the emotional or the psychological?
Well, it depends, right? They're all interlinked one way or the other. One doesn't exist without the other. It's a continuum. And so it definitely will affect how one thinks, how one feels, and how they act, how they cope with stresses of life, how they react or interact with other people. So it's a whole lot. It really is quite broad.
When we see a madman on the street, do we just call him a madman, or we say he's suffering from mental health?
I mean, the truth, I'm going to give a I'm going to give a more realistic.
That's the extreme, isn't it?
That is an extreme of a severe mental health condition. That is more likely going to fall in a group of mental health conditions that we term as psychosis. Psychosis again is a broad terminology, but oftentimes when you see people wandering aimlessly in the street, it's usually a sign of a mental health condition. And oftentimes for some of these people, if it was caught in time, it may not have gotten to that point.
Okay. To the man of the house, are we all mentally?
I should man up.
You should man up. Are we mentally stable or balanced as a people, as Nigerians, as we speak today?
Well, let me start by first admiring my dear sister seated here. It's not easy, even within her medical profession.
You say admiring. I hope it's not a mental illness this morning.
No. I'm admiring her for taking the very courageous step to specialize in mental health.
We will ask her the driving force.
A lot of people, a lot of medical personnel that I know, that would be their last refuge. And even within the economy of the medical profession, it has one of the lowest attractions. Not to be very honest, and that is because culturally we have limitations as to admitting mental health problems, or even taking care of mental health problems. Where there's this very interesting Igbo proverb. Madman no dey shame, na him people dey shame. So to the extent that people don't want to even identify with
stigma.
It's a high level of stigma. So people who work in that field and sometimes they tell you that psychiatric doctors, psychiatric nurses are also the same with their patients and all that.
They're all mad.
This is so when I see medical personnel, venture to specialize in addressing mental health, it's really very admirable. It's something that should be commendable, and we're very proud of you. But let me also tell you that last year by this time I celebrated.
That's the question I was coming to. Where is it more common? Is it women or men?
Well, you can't say. It all depends on resilience. Women are more resilient than men. But those of us that have worked very closely with displaced persons in particular, trauma victims of Boko Haram, you could see that women are more resilient than men. In fact, women maintain their sanity in times of panic on a much higher level than men. Because when the insurgents strike in a family, the man picks himself and begins to run away.
He abandons the family.
The woman begins to calculate, where are my children? Is this one around? Is this one not around? She even starts looking for the husband that had already gone away and left her behind. So, and when they come to an IDP camp, an internally displaced persons camp, or when we visited some of them in refugee camps in Cameroon, what we see is that the women are more organized, more resilient than the men. So, and because of this high level of resilience, the kind of things, the kind of trauma and depression that a woman can endure despite circumstances of her surroundings, men don't endure that much. And don't forget.
And why is it so?
Don't forget that in our society, the people that take antidepressant more are the men. It's the men that usually go to the bars and.
Okay, so I'd like to chip in here to maybe give you some sort of maybe a possible explanation for why these changes might be observed. So you see, mental health conditions are a wide range. So what the studies and research mostly would show is that most of the depressive or anxiety related illnesses may be more commonly seen in women. Whereas when we're thinking about substance use and psychotic disorders, where people start to hallucinate or start to have some strange beliefs and so on, are more common in men. And one of the theories that has been proposed as an explanation for this is that women tend to be internalizers, whereas men tend to be externalizers, which would explain why they would go to the bar when they're stressed
and try to drink away their problem.
Try to drink away their problem. So for women, they tend to keep it all in and ruminate and worry and think and all of these things, which is why they end up getting a lot of anxiety and depression. So I think that theory, in a way, is quite interesting in explaining some of the phenomena that we see. So some are more common in women, some
for a boy to
express emotions,
to run home at the, when in a fight outside, to even express emotions, to feel, no, it's not manly. It's just manly to be very mature and all that and all. But that is it. My question to my sister here, medical personnel, is that traditionally, a lot of mental health issues are attributed to forces that cannot
supernatural
forces, genes and all that.
Yeah.
How do you handle cases like that?
That is a very good question.
Yeah.
I mean, as you can see from my dressing, I am visibly Muslim.
Okay.
So that is my faith is a big part of my practice. And I'm not going to sit here and tell you that, there is no spiritual being or a spiritual aspect to our lives, because I very much believe in that. However, because of a paucity or a lack of knowledge of mental health conditions, what has happened historically is when something that you cannot understand or strange happens, then you find whatever explanation that comes to you that can explain it out. And it's not out of place for you to find people then just saying, okay, because this is strange and inexplainable, then it must be supernatural. It must come from another realm and all of that. And although, religiously, we have Islamic psychology, which is a very vast, yes, Islamic psychology exists. It also has its, explanations of some of these mental health conditions, which it recognizes, but just the way other aspects of medicine have evolved over time, cultural beliefs will fall into, and you have to take those into cognizance when you're interacting with the patient. Now, how do we diagnose a mental health condition? We have diagnostic criteria. We can either use, the ICD, which is a European classification for diseases, the International Classification for Diseases, which is updated every couple of years, or the Diagnostic Statistical Manual, which is the DSM, which is used in North America. So these manuals have diagnostic criteria for these mental health conditions. A lot of them have symptoms and signs that you look out for, and there's also a durational criteria that you follow. So when you look at the patient and you interact with them and you take your very comprehensive history, you look at it to say that, do they fulfill this criteria? If they do, then you can give them a diagnosis.
Okay.
So that's how we practice. It's evidence-based, right? If a patient still finds relief, which a lot of people do in their faith, then we will not discourage it, because in fact, it will improve their prognosis, which is how well they do in the illness. If they want to continue with their prayer, their prognosis, which is how well they do in the illness. If they want to continue with their prayers, they should, if they want to seek counsel from their
I'm very, very thrilled by the professional manner the doctor is addressing these issues. But we discovered that there is a very huge intersection between multidimensional poverty and mental disturbances.
Absolutely.
And there is also a huge intersection of relationship between inability of breadwinners to win bread, for the family, and their mental
and it's becoming more
instability.
difficult, isn't it?
So these are issues that we looked at, and they're still very germane to our discussions. They're still very concerned. And there are, I don't know whether there's a study also on the effect of technology. When we were growing up, and we were lucky to have grown up in an age where there was family, where there was
community,
where there was humanity to a large extent. Today we're becoming more distant from each other, and more glued to technology.
Yes.
And the announcements you get from this technology most of the times are very depressing. And I remember when they started, when the GSM came, there was this acronym. GSM was Gasaboma Ukachi.
Interesting.
Because
new madman.
People were like
247.
but no, even talking on the road,
Yes.
alone, and it made these things are beginning to. But I guess one of the most disturbing of all is multidimensional poverty. And when we say multidimensional poverty, in our own understanding, goes to such a level that people who are multidimensionally poor, to the level that they don't even have access to toilets. About over 30% of Nigeria's poor do not even have access to toilet. And when you drive on the major roads in Abuja here, you just take the road to Kubwa, take the road to the airport. You see somebody would be in the middle of the road and will be defecating in that middle of the road. Vehicles going this way, vehicles going this way. Even if the person is supposedly sane.
Okay. So he's insane for him to do that.
No. Something must be wrong.
Somewhere.
Something must definitely be wrong.
But at what point people begin to show the sign of mental health? Because are we mentally balanced?
Yes. I would like to believe so.
Me, you, and him.
We would have to do more detailed and comprehensive assessments before I stick my neck out.
So how do we begin to see? I mean the symptoms. Some of the symptoms that tells you that this person has one mental illness or the other.
Yeah. So like I've been mentioning, it's
so
very
is it that when I'm depressed
vast.
now? Or I have anxiety.
Yes. So depression and anxiety.
Who beats his wife is mentally unbalanced.
You see, I mean, depression and anxiety are a very common group of mental health conditions, right? So, of course, someone who has depression that is diagnosed clinically is suffering from a mental health condition. But of course, this is not the fact that you've been diagnosed as being depressed and you're on treatment does not equal you are mad and that this is the entire story of your life. We need to sort of reduce the stigma and demystify some of these false beliefs that people have against mental illnesses, because you are not your mental health condition. Why is it that if someone is hypertensive, when you see them, it's not just they don't become all of their hypertension? Or if someone is diabetic, is that all they are? I mean, a human being is much more than that. So if people are depressed, some of the common signs you would see, if we're using, because depression is quite common, is, they would have persistent low mood. Right? So feeling sad for prolonged periods of time. In fact, for it to be able to meet the criteria, it has to have been going on for a minimum of 2 weeks. It can be much longer than that.
So if
but 2 weeks is the minimum. Not just sad, right? Then low energy, when you're really, really weak and unable to do the things that you want to do, and it's not from a physical cause. Because remember that when someone comes to the hospital, they're going to have to do a series of investigations to make sure that there is nothing physically wrong before we start to consider a psychological origin for the problem. Sometimes, again, people who are depressed would lose interest in things that they used to find pleasurable before. They would have poor sleep, poor appetite. They would start to feel guilty about things. You'll find them sometimes apologizing for even things that are not their fault. Excessively apologetic, hopelessness in the future. It can be so severe that some people start to contemplate suicidal thoughts. before it now reaches a degree where they now attempt to take their own life, you know. But just like he had mentioned, absolutely, there are loads of studies that are available. People can even look it up online about the link between this technological revolution and mental health conditions. In fact, you would find that
around the world.
Yes, around the world.
We are lonely.
Yes.
We have 10 million followers.
But
we have no friend around.
Exactly. And after COVID, there was actually a sharp increase after the COVID-19 pandemic. So because of that isolation, they actually, since then, we've actually seen a very sharp increase in mental health conditions. And a lot of people are coming up proffering ways for us to, you know, reducing screen time with children, putting your phone down when you're around your loved ones and just talking, checking in on one another. All these things will go a long way in, you know, taking things back to the way they were.
How often do people display mental health conditions?
So to be honest, I would say the statistics show that maybe one in every 6 individuals will suffer from a mental health condition at one point in their life. But remember, again, we're not talking about mental health conditions as per those that maybe you would find on the streets and so on. It can be the, you know, the depression that no one notices, the anxiety that is gripping at someone on a day-to-day and nobody even knows their struggles.
The aggressiveness unnecessarily.
You know, yes, irritability is actually a very core symptom. It can be present even in depression, it can be present in anxiety disorders, and even in other disorders where the smallest thing just gets a person very agitated and they're snapping at everyone, mothers snapping at their children.
But some people are like that, isn't it? Naturally, they're very aggressive.
Absolutely.
They snap at the slightest,
yes.
opportunity.
That would not equal. That would not equal having a mental health condition, because when we take a history, we actually ask the patient and people that are around him, that live close to him, about what his, his habits and his character was like before his illness. So, of course, if it's someone that has always been known as irritable, then in light of their condition, then that would not necessarily be a symptom. It's just who they are, right? And that kind of person may benefit from therapy to help them handle things better.
So what do we do with people who harass others many times, all the time?
Yeah, so these people...
I'm not talking of anybody in particular. But some people harass.
Do they need to go do they need to go for
therapy?
Therapy.
The thing with
one person.
And then you have a client or a patient this morning. But in addition to that, for some jobs, people need to get mad to be able to, execute those jobs properly. So are you mad for you to be able to be a good psychiatric doctor?
So that's actually something that he mentioned earlier. And I think it's one of the myths that I want to debunk.
Okay.
A lot of people believe that maybe for their observation of how psychiatrists may interact with their patients and so on. So oftentimes, if you're not someone that is in the field, when you watch a psychiatrist interacting with a patient and really listening to them, for example, the person is telling them that, I hear voices when I'm alone. And the person is, I'm engaging, let me take myself as an example, and I'm engaging the patient and saying, oh, tell me about these voices. Is it people that you know, or is it people that you don't know? What are the voices saying to you? Do they comment on the things you're doing? To someone watching that, it almost sounds like, you're really indulging this mad person. You must be mad yourself. So these are some of the examples of how people have come to these conclusions, but it is absolutely not true.
But how do psychiatric doctors deal with the stigma they themselves? Because everybody see them as mad people.
Yes, even within the medical profession. Yes, within the family, within their own community of medical professionals. It's just now that I think there is more awareness, so it's a lot better than it was in the past. And I think it's improving steadily, which is why we continue to raise awareness and say, just like I said at the beginning of the show, that mental health is as vital as physical health. Some would argue even more, because if you're not mentally fit, then you really cannot function as a full human being and be productive to your society.
But doctor, let me ask a very interesting question.
All right.
And I've seen quite some ages, so I can come traditional as well. In in the olden days, and up till today, but in remote places, one of the treatments for people whose mental health stage has crossed all boundaries and has gone to the extreme of madness are flogged as a treatment.
Yeah, that's actually quite sad. Yeah, it used to be the case, they even chained.
Yeah.
Treated like animals almost. But that's why, with the with the Mental Health Act, which we now have, and it's going to probably soon be implemented, it really has debunked a lot of those practices. Just because someone is suffering from a mental illness does not mean that they should be stripped of their humanity as a whole. And so there are specific ways to de-escalate a situation. For example, when someone is aggressive, there are actual steps that should be taken. Flogging them or, chaining them. Sometimes you may need to softly physically restrain them, not with chains or anything that, is dehumanizing.
For some, they are very wild. So, the best way to calm them is to chain them.
But let me tell you, doctor, it worked in the past.
Okay.
It worked.
It worked in what way? When you say it worked, what did it do?
At least some of them recover.
After being flogged?
Yes.
Flogging.
Yes. And so we still begin to question what really happened. Was it that actually the situation was not what we thought it was?
Exactly. I was going to say that. Exactly.
But it worked.
Well, I wouldn't be able to speak for that time because I wasn't there.
But that would be like you encouraging flogging.
Exactly, and that's absolutely not something we encourage.
But I am telling you
that from his experience.
And there are people who still believe that method works.
There's still people. Yeah. There are still people chained. There are still people as we speak. There are people
that
who
is
are flogged.
True. That is true.
And there are also people who, as a Muslim, there are people who still rely on Ruqyah, and it also works for them. So it all depends.
But I would say, Ruqyah is not a bad thing. What is Ruqyah? Ruqyah in Arabic, it's just praying for the person. Praying over water, giving it to them to drink and so on. And oftentimes we get, because again, I told you there's a whole field of Islamic psychology. If the origin of the person's mental illness is spiritual or, in origin, then they might be healed from that. But there are situations where it can either be as a result of some chemical imbalance in their brain, all of these things. And so you would find that they will continue to do these treatments and there will be no response or no improvement, and they will still resist coming to the hospital because they just believe that this is not a medical problem. That's why I'm saying it's a holistic thing. So you identify what the cause or the root of the problem is, and then
but that's please help us understand chemical imbalance in the brain. Yes. Because for some people they say a knot and the brain is being loosed. That's why the person.
I think that's just a metaphorical statement.
The man has two SIM.
These are all just, I think, metaphors that people use to explain out these things. But the truth is, illnesses of the mind, mental health conditions, which in fact are, illnesses of the mind. They happen oftentimes. So the biological aspect of it is we have a lot of chemicals in the brain that we call neurotransmitters. And for proper functioning, they need to be at a certain balance. Now, for some people, they might have an excess of certain neurotransmitters. For some people, they have a depletion or they don't have enough of those neurotransmitters. So those who will be treated with, medications, the medications strive to restore that balance. Of course, some people still do not believe in that. And being a doctor, I am a proponent of autonomy. No matter how much you want to help someone, if they do not want to receive that kind of help, you cannot force it on them.
But there are also people who believe, very sincerely, that at the early stage of mental illness induced by substance abuse.
Okay.
Perhaps that explains some of the things that happens in the traditional therapy. When the person is chained and deprived of those drugs for quite some time, and the system perhaps excretes the ones that are excess in the body, that the person may regain balance. That's
but that's not out of place. I mean, that is modern traditional practice. That is what happens in rehabilitation facilities, right? When the patient comes, they're going to be there for a period of time where there's a detoxification of the drugs from their system. Substance use is another wide field in psychiatry. Substance abuse is even something one can stop specializing because of how wide it is.
So which one contributes more to mental health?
To be honest, I would say it is a vast, especially now. There's an increase in substance use disorders, just like all other.
Who are the category of people that rely on substance use for them to be able to function?
There are many. There are many. There are people who you hold them in highest esteem. They hold positions. Some of them are leaders. Some of them are influencers. Some of them are business people, musicians, and the rest. Some of them are, even judges. Unfortunately, people who have a shortage of courage to take very hard decisions, who think that they need something to assist in propelling them to develop some temporary courage and to take certain decisions and confidence. So there are many things within the system that if a person is not, balanced, it will be very hard. A lot of people don't understand. You see, in Nigeria, for example, we've come to abuse the red biro. If you come to Abuja here, every senator, House of Reps, minister uses a red biro. But the origin of the use of the red biro has nothing to do with all these other people. The governors are the only ones that are actually technically allowed to use the red biro. And the reason is simple, that even if a judge sentences you to death, you cannot be killed unless the governor signs the warrant. And it's that power over life and death that gave them the red biro.
Okay.
The president cannot sign for you to be killed. The president can, through the prerogative of mercy, pardon you. But he cannot sign that this person should be killed. The only person that can sign a warrant for a person to be killed after a death sentence is the governor.
Not even the judge?
Not the judge can pronounce death sentence.
Okay, but he won't sign.
He cannot say go and kill the person. Take him to prison. Then the person goes to prison awaiting a warrant by the governor. And governors in Nigeria today hardly sign this warrant. That's why
when we see court of competence, sentencing people to death.
To death, yes.
Don't they sign?
They sign their judgment, but the warrant to have that person executed is in the hands of the governor.
So in places like Abuja, who now signs? Is that the minister?
In places like Abuja,
well, we don't have a governor.
It's the minister who operates like the governor.
Okay.
But it's the governor's job to sign a warrant. That's why when they declare that a person should be hanged or killed or whatever, you see that all the clemency appeals go to the governors.
Okay.
The president does not have that power, so he uses the green biro.
Okay, so and the doctor, and the governor needs to take something to also to be able to sign.
I'm only saying that when you are faced with a decision
of life and death,
it's sometimes some people need not just their normal courage, but to go. It's the same thing. Yeah. Some musicians that you see that are performing very well before a large crowd, they also have stage fright. Sometimes they needed some assistance.
But how ridiculous is it, doctor, when a judge takes substance to sign a judgment or to pass a judgment?
I mean, we can only work on proof. right? So unless one can prove that they're definitely acting under the influence, which if they are, then they have even a judge has a line manager. Everybody has a line manager.
Okay, to make your work much easier, should we be conducting tests on judges, yes, especially judges, because politicians, we can say, okay,
they're actually the ones that need tests.
No, but even the judges themselves, so that we can be able to protect the judiciary, who make sure that law and order is sustained in the society.
Well, I would probably just recommend, if I were to give a recommendation, that how when you're about to start a job or when you work in an office, they require medical fitness certificates, and oftentimes you would go to the hospital, they would check your urine, they would check you for HIV and some other communicable diseases, they would do a chest X-ray and all of that. Maybe it should be considered to increase a mental health assessment
for everybody.
For everybody. At least that, especially with high stakes positions, if there's any thought or suspicion that the person may be acting under the influence. But again, these are recommendations. It's not something that is going on right now, but I think it would go a long way.
Okay. And let's look at this year's, theme and your week that you celebrated. What is the message that, that celebration took to the street?
All right. So this year, the Mental Health Department of the Federal Medical Center, with the support of our Chief Medical Director, Professor Saad Ahmed, had a 2-day outreach. The first day we celebrated in the hospital by doing a walk around to raise awareness about the Mental Health Day. We also had a talk with various members of the units talking about mental health conditions, how to recognize them, treatment options, and so on. But interestingly, this year's theme, which I think is absolutely perfect for what is going on in the world right now, which is access to services and mental health conditions in catastrophes and emergencies. We're at a time where there are so many conflicts, so much insurgency, so much crime, and so on. Some people, like he rightly said, have been displaced from their homes here locally in Nigeria, the Boko Haram crisis, now the crisis that's going on in the northwestern part of the country and other parts of the country, really, even in the southern part, we still have pockets of these insurgent activities. And then globally, we are watching every day right in front of our eyes the conflicts in Palestine, and how these people are killed on a daily basis, and they're being stripped of their very human rights. In Sudan, in the Congo, in other parts of the world, we're seeing all of these crises. So this year's Mental Health Day is trying to say that, when these people's homes and their livelihoods are stripped away, the destruction is not only physical, but that their minds are being destroyed as well. Because when these things happen, they break them psychologically. Some of them end up with conditions like post-traumatic stress disorder. A lot of people know about PTSD, but when they think about it, they only think of, these severe conflict regions or maybe soldiers. But the truth is, a lot of these people haven't faced, stressful situations that other people may not even be able to overcome or, deal with. So they're at risk of a lot of mental health conditions, depression, PTSD, anxiety, and so on. So I think it's very apt, which is why, I would like to digress a bit. You mentioned about how there's a lot of stigma. I think what has helped us at Federal Medical Center, and why I'm particularly enjoying my practice at the moment, is because we have quite a strong backing from our medical director. He's someone that is passionate about looking at people holistically, to say that when you treat an individual, you shouldn't only cater to their physical needs, but that you should see them as a whole human and that they have a psychological aspect to them. And that's the reason why we've been able to achieve what we have. And on the second day, we decided to go to an IDP camp, which is not so far from the hospital in the Galadimawa district, is the New Kuchingoro area. And most of the inhabitants of this camp were displaced during the Boko Haram crises and so on. And we actually went to them and we spoke to them and told them, what we're here for, to raise awareness, to tell them that we know that they might have had doctors come to them and cater to their physical needs, but we're here today to cater to their psychological needs and to provide counseling and treatment for those who might require it.
Let me share an experience with you and for you to understand the effect, and I want to know your own views about it. For 4 years, I served as chairman of what we call Durable Solutions Committee in my state. And the durable solutions were actually supposed to provide durable solutions for people who are displaced. I had 26 IDP camps I was managing.
Wow.
But with about 900 and something persons. But within 4 years, we were able to close down 22. And
that's fantastic.
And, with less than, with about 30,000 people, generally.
Yeah.
But what we realized mostly is that, number one, a lot of these people who are displaced, they need more psychological approach to understanding their situation. A person who is used to independence, a woman who could decide what she was going to cook and then how to share it with her family, and suddenly becomes an inmate in a camp, waiting for
sharing a small space with so many other women
and makeshift homes.
Makeshift homes. And so we began to understand that, and we used the media to actually begin to interface with them and make them understand. But one thing that was always constant was the fact that displacement also makes them begin to lose hope in humanity itself. They begin to feel less human.
Yes.
And some of them harbor dislike for the entire system we are operating. And they feel abandoned and neglected. And so we had, interacted with them. You're talking about access. That's where the problem is.
Absolutely.
All the funders, all the supports, including government, I can say that with a lot of confidence, are more concerned about the physical health of the people.
Not the emotional.
Not the mental health.
Yes.
And so you will find, there are provisions for all ailments.
Exactly.
But no provision even for trauma counseling.
Yes.
Not even provision for trauma counseling.
Yes.
And that is well. And then secondly, we could sit down in Abuja here and clap for ourselves because we have Jabi, we have the teaching hospital, and we have high-profile, private medical facilities. When you go to the communities, under the training for primary health care providers, what you have are essentially this one that the JHU and CHU.
Yeah, community health extension workers.
Yeah,
exactly.
They're usually
not professionals.
No, they don't even they don't even receive instructions on mental
That's actually one of the things that we're putting forward to say, we're putting it out here to the government that this should be considered basic training in identification and improvement of referral services. You may not be able to go the full length, but you should be able to at least identify, give the first aid treatments there to say, okay, this is what we think is going on and help is near.
Okay, considering the number of psychiatric, doctors in Nigeria, I know a medical doctor on this program told me just about 300, medical, psychiatric doctors
that
in
have
Nigeria.
Been fully
300.
I said because most of them are running away
aside from
for
that,
a population that is almost 240 million now.
And today we have more people in refugee camps. We have more displaced people. The numbers keep increasing.
But so you see,
and so we have more mad people who look sane, but deep inside they are mad.
We are not mad.
If you continue to use
mental problems,
or if they have mental health challenges, if you continue to destigmatize, we need to also wording is very powerful. And that's why you would find that there are many times around the world you see that even the terminologies for disabled people keeps changing
yes.
because words are very powerful. So we discourage the use of terminology. So you wouldn't hear me in my practice using the word mad or lunatic or insane. So it's better because we're trying to reduce the stigma. Continuing to say this will make people, even if they're having the challenge, to hide out. We have mental health professionals that are suffering from one mental illness or the other, and you can see how the extent they go to hide their visits so that their unit does not even know they're seeing doctors at the mental health facility. And the truth is, just like you said, psychiatrists are not the only people who work in mental health. So the truth is and more people are showing interest. Of course, with a population of about 300 psychiatrists, how much can we do with a population of... So we also work with clinical psychologists. Clinical psychologists are very important. They play a role. In fact, most of the time, they handle the therapy aspect of the treatment. And then, social welfare officers, very important as well, because sometimes there are social issues. So all of these people, psychiatric nurses, also play a role. So it's usually a multidisciplinary team. It's not just the psychiatrist, but
you just answered my question.
Yes.
Because I was just looking at the situation where if somebody has certain physical challenges, there's a physiotherapist that comes to handle. Now, if somebody has a mentor, who is his own physiotherapist?
Exactly. That's actually such a good analogy. I don't even think I've heard that one. I'll remember that for sure. But yes, we work as a team.
Okay.
We definitely
all right.
do.
As we begin to wind down, if you are going to be speaking to people out there and to say, look, forget the stigma. If you have a condition, you just walk to any, psychiatric and just tell him your problem. But there are also psychiatric doctors like you who are also aggressive. Who are also will not go into there's no empathy in terms of the discussion, because somebody who has mental issue needs somebody with a lot of empathy, with a lot of consideration, and for him to be able to get the best out of that person. Because if you are speaking to a woman who is being battered by her husband for many years and whose children, it ended up in divorce, her children are taken away from her, for you to be able to even get her to speak.
And these are things that you're trained in. I mean, I don't see how you can be a good psychiatrist or mental health worker in whatever capacity that you work. I don't see how you can do that without empathy. That is probably the foundation of all mental health practice. Empathy. And what does empathy mean? It's putting yourself in the person's shoes. The moment you do that, you're able to, when you just think, if this were me, how would it affect me? How would I act? And once you do that, you may not exactly be able to comprehend to what extent, but at least you can empathize. So I can't speak for everyone. There are individual differences. Some people by their nature are more compassionate and more empathetic, but part of your practice and your training requires you to actually use that empathy.
But I have a request.
Okay.
Since I'm sure you have a structured system through which you interface with authorities, governments. No. Government authorities and the rest. Don't you think it's time you started working on proposal for a review of training at the primary healthcare level, so that people can be identified and be trained to start, looking at mental health issues at the lowest level? Perhaps, even if it's just for referral purposes.
Exactly.
But we need that. And I don't know whether if you have a body, a very strong body, whether a body can do a study and put up a proper proposal. Some of us, you can count on some of us to help you push it further. but it's actually needed. I am a village person. I come from the village. I'm a local person, and I know that
We are in the city.
a lot of the things that happens, sometimes happens at the very, very lowest levels, and they escalate, and not only in mental health, but in the case of mental health, there's a total neglect at the lower level.
I agree.
Total neglect.
Yes.
But even in the physical health,
yes.
I just lost a cousin because he was sick in the village. And the wife went and invited
traditional healer.
No. If it were a traditional healer, it was understandable. Just primary health care personnel, community health extension worker who came and fixed a drip for it in the house, and overnight. And by morning, the situation had deteriorated to a level that when they took him to a hospital, a proper doctor, just told them that it was too late. So we need some intervention at the lowest level that could guide even those of you that are at the highest level. That look, we have discovered that this guy's complaints are this and this and this and this. Please, we're referring him for further consideration at this level, but to neglect it completely at the lower level, and then not everybody has the access to. It's only those of us that are pursuing Zaki Damaiko that can come to the city. And
the thing is,
okay, in addition to what he said, we have an emergency situation. More people with mental health due to displacement, crisis, and all of that. Where does the religious body, come in to kind of, create a kind of balance? Because the psychiatric doctors are in.
I don't think there's an imbalance, to be honest, because these are social issues. So a psychiatrist is uniquely positioned in that they don't only look at the physical or even mental aspects of things, but they also have to look at the social determinants of health. Okay, and these social determinants of health are very broad. And so spiritual leaders, traditional rulers, they all play a role, which is why if you're going to do sensitization at the grassroots, it's not going to work if you don't involve these religious and traditional healers, because these are people that the community have trust. They trust them, they would follow them. So when you're able to sensitize them,
to trust, but quite a number of them have
but can we also, train the traditional institutions, some of them, and when they speak to their subject, to try and identify, symptoms of this mental health, and isolate them and say, okay, we will refer you to, a proper
just like in the maternal health issues. There are traditional birth attendants called Morzoma. Can we begin to harvest
something like that?
And structure it in such a manner that there will be understanding from the bottom to the top.
Yes.
Even the traditional healers themselves,
that's what
the ones who flog people,
they need to be sensitized and taught better ways to say that things have changed.
Yeah, so that they can help reduce the number of people who have those kind of illness.
Yes, actually, treatment and identification, all of these, it's supposed to help these people live in their societies, because some of them, the moment they're identified, there's so much stigma. Nobody wants to associate with them. Nobody wants to marry into that family. Nobody wants to. There's so many
that's
things.
That's why the Igbo man says, madman not the shame. Now him people, the shame.
Exactly.
So, and because him people no one shame.
They send him out.
Yes.
Okay.
Yes.
So before we go, there's this impression we're trying to, clear that men suffer a lot when it comes to mental health. But because they have to drink and do all of that, but it doesn't go away. And this issue of man up, for every situation you have to man up. What exactly will you be telling the men, and what should they do? Because so that it doesn't get into some deplorable or very severe, situations.
That's actually a very good question, because a lot of times, attention is, when you think about mental health, a lot of attention is on the women. But the truth is, mental health challenges are faced by both men and women. I'm not going to propose an exact approach to managing mental health conditions in men and women, because men and women are distinct, beings. And even the way our brains are wired, research has shown, is quite different. But culturally, I think this is probably one of the major reasons why men tend to deal with emotional or psychological problems the way they do, because the society has ingrained in them that when you're a man, you must take everything. Even when you're breaking, you must not be seen as weak. So even when life is throwing so many challenges at you and you need help, you must just be a man. You must not cry. You must not complain. You must do the work. And we're not saying that men don't have responsibilities, but we're saying that, these men are also prone to having some of these psychological breakdowns. But what I would suggest is that men also need to maybe take a page from women's book and build stronger communities amongst themselves. They need to be able to have safe spaces amongst themselves, because for some of them, again, from culture, they just think women don't know what they're saying and what, but when they're hearing it, no, I'm talking this is the reality of where we live. So when they hear it from their fellow men, and this guy is like, guy, honestly, even me, things have just not been good. I'm hardly able to sleep. In fact, I had to even go to this guy to give me some pills under the bridge for me to just be able to sleep. And then this guy is like, no, you shouldn't be doing that.
Absolutely.
So I would suggest something practical is that men need to build stronger communities of support amongst themselves, and to not feel that they're weak just because they're going through a lot of psychological distress, and that they should seek help.
Okay, to the only man in the house, at what point do men cry? Matured men like you, at what point do you cry?
when harassed by women like Madina. Well, but truly, Doctor, what I just want to know is that there are degrees of this mental health breakdown, and there are levels. And something I witnessed in 1983 that keeps recurring on my mind. We're walking in Yola, Adamawa State, and then my Tatsine then broke out, and they were killing people, and everybody was running away, including mentally disturbed people. But there was one
such a dissociation of the person's being with their surroundings, that it's as though we all exist, but the person is living in a different reality to us. And oftentimes things get that bad when, no help has been proffered, no solution. The person has just been left, and they go deeper and deeper into this, disease of the mind. So they might have just been so out of tune with their environment. And because they have conditioned their minds, this is one of their coping strategies to continue to survive, to do this routine every day, that not even